So welcome. Let me introduce myself first. So I'm Dr. Erin Katribe. I'm the Director of National Veterinary Programs for Best Friends. And today we are here to talk about one of my favorite topics, and that is managing infectious disease in shelters. I am sure that all of you have experienced that infectious disease. It can be life-threatening in shelters. And even for diseases that the disease itself shouldn't be life-threatening, if we don't have the resources to manage that in the shelter setting, then those diseases can be life-threatening. The classic one that I think of is ringworm, right? So ringworm, it's a fungal infection of the skin. So no cat or dog should have to, lose their life because of a skin infection. But unfortunately, because of that contagious nature in shelter environments and in shelter settings, sometimes we have to make really tough decisions, even for diseases that shouldn't, like I said, in essence, be life-threatening, but they are in our world. And so that's what we're here to talk about today is managing infectious disease, preventing infectious disease, because that is absolutely a huge part of life-saving. This is our outline for today. So we're going to start with disease transmission basics. What I find a lot of times in the shelters that our team visits is that while folks have heard of these infectious diseases like ringworm, like parvo, shelter staff often don't have a true solid understanding of how all of those diseases might be transmitted in the shelter setting. And so we'll talk about that first. Then we'll dive into strategies for disease prevention. And then very, very briefly, we're going to go over sort of the top shelter diseases and how these disease prevention strategies apply to those. So first, let's start with disease transmission basics. Some key points, some definitions to lay the groundwork for what we'll talk about today. First is pathogen. So when I say the word pathogen, this is just an umbrella term for any virus, bacteria, fungus, parasite, any of those different organisms that cause disease. And so that word, like I said, just an umbrella term. You'll hear me say that today. A key point related to most of these pathogens is that they're microscopic. What this means, right? We can't see it with the naked eye. And so an example would be a puppy that's shedding parvo, for example. That puppy, say they have diarrhea on the floor. We clean up that diarrhea, and we can see the poop, right? But we cannot see the actual virus. Just because we've wiped up that feces, that virus can still remain there on that surface, on that floor. When we look at that floor, we cannot see that parvovirus. And so for the vast majority of the pathogens that we'll talk about, they are in fact microscopic. And so we cannot look at a surface or a floor or an object or even an animal and know, we can't see that pathogen. We can't know if that pathogen is present or not because those bugs are microscopic. Next is incubation period. This is the number of days from exposure to when clinical signs start. So in a parvo example, say we have a healthy puppy and we have a sick puppy with parvo, and those two puppies get placed in a kennel together. The puppy that's healthy is going to get infected with parvo potentially, but that second puppy won't get sick right away. There's a certain number of days that go by before that puppy starts to show clinical signs. And so that period of time is called the incubation period. What is really critical is that for many of our diseases that we care about in shelters, parvo included, animals that are in that incubation period can still be contagious. So even though that puppy looks healthy, that puppy is going to start showing clinical signs in a day or two, that puppy is contagious today. So animals that look healthy can still be contagious, can still be spreading infectious disease. And that's going to be really, really important when we get to the content later in the talk where we talk about how we handle those animals that are potentially high risk. My last point before we move on is going to be that some pathogens are hardy in the environment. And what that means is, for example, again, with parvo, if there's a floor that's been contaminated with parvovirus, that virus is microscopic, right? We can't look at that floor and know it's contaminated or not. So we can't tell that parvovirus. If we do not clean and sanitize and disinfect that floor appropriately, that parvovirus can live for a really, really long time. So months and months and months, potentially. That parvovirus could live in soil outdoors for months and months and months. And so for many of the pathogens that we care about a lot, they are hardy in the environment. Like parvo is one of them, so is ringworm as examples. All right, let's talk about how diseases are transmitted. First is going to be direct contact. And so this one is one that folks are pretty familiar with, right? This is when we put a sick animal with a healthy animal, and so that disease transmission can happen through direct contact, through those animals interacting. Next, we have droplets or airborne transmission. And so this is what I think about when I think about our respiratory diseases. So droplets are, for example, when when a dog sneezes, or airborne or aerosolized is when, for example, a dog coughs or barks. Dogs are really great at aerosolizing their respiratory pathogens. And so those pathogens can travel a really long distance. This becomes critically important in shelters because I think about 20 feet, sometimes even more, but I think about that distance in a crowded shelter. That's the dog in the kennel and their neighbors, and probably their neighbors' neighbors, and the dogs across the aisle and their neighbors, right? So 20 feet in a crowded shelter environment, that can be a lot of exposure when those pathogens are aerosolized. Aerosolizing of respiratory pathogens is only something we have to worry about with dogs. Cats are not quite so good at that, right? They don't get the velocity behind their respiratory secretions, but aerosolized pathogens in dogs is going to be important. Fecal oral. So this is when we have pathogens that infect the gastrointestinal tract. So parvo is again a classic example. They're shed in the feces. And then when another animal encounters that feces, or pathogens that are left even after we clean up the feces, if we haven't disinfected appropriately, then they will get exposed via their mucous membrane. So that means their mouth, their nasal cavity. And so that's called fecal oral transmission. And then we have fomites. And so fomites, you may or may not have heard this term before. Fomites are any object, inanimate or potentially us, that can become contaminated with a pathogen. And then we physically transmit that pathogen from one animal to the next. So the animals don't have to come into direct contact. But for example, I use a litter box scoop. I scoop the litter box of a cat who is infected and shedding panleukopenia virus. And then I, without disinfecting that scoop, then move on to the next kennel of a healthy cat. And then when I scoop that litter box, I have potentially unknowingly transmitted that panleukopenia virus from one kennel to the next. And so the classic examples of fomites in shelters are things like cleaning equipment, so litter box scoops, potentially brooms or squeegees, that sort of thing. It can be food and water dishes. And hands down, probably the most important one in shelters is actually going to be us. It's the people. It's us getting contaminated with these microscopic pathogens that we can't see and transmitting it from one animal to the next. I have a couple of photos here. These are both photos in clinic settings of a veterinarian and of a technician. And in both of these photos, you can see those staff are wearing gloves, which is a great way to prevent disease spread, which we'll talk about here in a little bit. But in both of these photos, right, in the one with the puppy, she's holding that puppy close to her body, and she is also holding that puppy close to her face. And in the second photo, she's wearing gloves, but again, she's kissing that cat. And while we love kissing kittens, we love, loving and cuddling on animals, your face or your body, your clothes, any of that can also be a fomite. And so despite wearing gloves in these pictures, if, for example, that puppy were shedding parvo, then the front of her sweatshirt is going to be contaminated with parvo. Their faces in both of these photos are going to be contaminated with that infectious disease. And so the next puppy or kitten that is held or that is kissed, right, could actually, that could be the source of infection. That's the fomite. This list of mechanisms of transmission, the possible mechanisms are going to be different for different diseases. For example, with parvo, we worry about fecal oral, the airborne and droplets, we worry about that with respiratory diseases. But for the vast majority of pathogens in shelters that we worry about, direct contact and fomites are going to be important. And then the other mechanisms are going to be variable. We'll talk about that specifically when we get to those diseases, those specific diseases later today. Now, I want to look at fomites in a little more detail because, again, so important in the shelter setting. And I do feel like it's just not well understood in most shelters. And so we have a little video that I'll show. So this is obviously something that we staged. But in this video, we have two cats that are kenneled. We have the orange tabby and the gray tabby. And Megan is the technician in this photo or in this video. She's going to move these cats from one area of the shelter to the next. And so she comes up to that orange tabby. She introduces herself. She picks up that cat. She's holding that cat close to her body, which is great to make that cat feel safe and secure. And then she's going to place that orange tabby in that kennel. We can use the example of, say, these cats were in the holding area and they needed to be moved up to the clinic for spay and neuter surgery. So Megan will take that cat off to the clinic. Now, what we can't see, right, are any of those microscopic pathogens that this cat in our scenario was infected with. What we did for this scenario is this material, this powder that is invisible to the naked eye, but glows under the black light. And so what we did is we put some of that on that orange tabby. And so this is Megan's hand, and you can see that she's become contaminated with this material. Now we can pretend, say this was, for example, panleukopenia virus. And so Megan has become contaminated with, in our pretend scenario, this panleukopenia. And again, can't see it with the naked eye, but when we look at it under the black light, we can. You can also see this is the front of Megan's shirt. And that too, because she held that cat close to her body, also became contaminated. And so in this next video, so Megan's now going to come up and move that second cat. And so this is the gray tabby. Same thing. So introduces herself, holds that cat close to her body, moves that cat into that kennel. And then we'll take that cat off to the clinic for surgery. Now, so Megan became contaminated from our first cat that was shedding our pretend panleukopenia. And so this is the gray tabby. This is the second cat. And this is what we find when we shine the black light on that cat. So this cat got infected with our pretend panleukopenia. Now, even if Megan had been wearing gloves to protect her hands, well, you can also see, it's a little bit harder to see, but you can see it on that cat's body. Even if she'd been wearing gloves that protected her hands, because she was holding both of those cats close to her body, great for low stress for those animals, but also a potential source of contamination if we're not taking extra precautionary measures. Now, in order to set up this scenario with our stuffed cats, our stuffed cat patients, we went into a storage closet to use the black light so I could take these photos. And I thought this was interesting. This was completely accidental, but so this was the door handle inside the closet. And so you can see also contaminated with our pretend panleukopenia virus. And so this door handle in the scenario is a fomite. Another scenario that we set up, so this is Steph, and then this is actually my dog that we used for the video, but pretend that this is Steph walking through an area of the shelter, and she encounters a dog in the aisle, and she pets the dog. And then Steph goes on about her day. And so her next task is sweeping, and so that's what she's off to. And say in this scenario, this dog was shedding canine distemper virus. Same thing, it's also microscopic, can't see it with the naked eye, but Steph now has become contaminated with canine distemper. And now the broom has also become contaminated with, for example, distemper in this pretend scenario. And so the next person that comes and picks up that broom then also gets distemper on their hands. And so when they meet a dog in the shelter or handle a dog next, they potentially have become that fomite and are transmitting that disease. And so I hope that these examples illustrate for you how fomite transmission in shelters can be so important, right? And we think about all of the shared equipment, the shared surfaces, the floors. There's so much opportunity for disease spread in the shelter for all of these pathogens that this fomite transmission is hugely important for so many of them. All right, with that in mind, let's move on to preventing disease. So we understand how diseases are transmitted. What can we do to prevent disease in shelters? When I think about disease prevention, I think about these three major categories of prevention strategies. Number one is preventing physical transmission. So it's thinking back to that fomite transmission or to preventing direct contact between animals. Are there things that we can do that limit that physical transmission, that stop fomite transmission? I think about enhancing the immune system to better fight off infection. The classic one here is going to be vaccines, right? So vaccines for the diseases for which we have vaccines for can enhance that immune system. And then I think about reducing the number of potential exposure points. When I talk about this one, I encourage folks to think back to the early stages of the pandemic and the advice that we were given, right? We were told, don't gather in large groups, especially indoors, because if one person in that room is sick, and then that could expose everybody, right? It's that same idea when we think about disease in animal shelters. Uh, it's reducing the number of exposure points. And what is animal sheltering? But gathering a whole bunch of animals with unknown backgrounds in a building together, right? There's so much opportunity for one animal to be sick and for it to be spread to others based on direct contact or, again, based on that fomic transmission. When I think about animal shelters, I also like to think about who is the most at risk for becoming infected with infectious disease. So, who are we the most worried about? And that's going to be two categories of animals. It's going to be young animals. So, puppies and kittens, they have underdeveloped immune systems. And what we'll talk about here in just a bit is even if we're vaccinating them on the appropriate schedule, we don't know for sure that our vaccines are effective. Again, we'll address that in a second, but just keep in mind young animals, very high risk. New intakes, I also consider high risk. And that's because we don't know, even in adults, if they've been vaccinated before. And we also don't know what happened to them before they came into the shelter. So is it, an adult dog that was exposed to canine distemper yesterday, and now they're going to come into the shelter and potentially be contagious and get sick here shortly. This was a study out of Florida looking at what percentage of dogs were not protected against parvo and distemper at the time of intake. And so for parvo, it was 78% of puppies were not protected against parvo at the time of intake. And for distemper, it was 57% of all dogs, adults and puppies included, and 88% of puppies. This is huge. These are huge proportions of our potential intake. And this is just showing, again, because we don't know the vaccine status. We don't know their response to any previous vaccines they might have had. And by and large, many of them are unvaccinated, right? And so these proportions of animals, these puppies and dogs, would be susceptible and become infected if they were exposed to those diseases early in their shelter stay. Well, what do we do about that? And so, in the bucket of enhancing the immune system to prevent or reduce infection, we have vaccination. For the diseases for which we vaccinate for, vaccines are a key strategy. When we talk about vaccines, it's important to understand some of the vaccines we have provide what's called complete protection, and some only provide partial protection. So, what that means for parvo, panleukopenia, distemper, if an animal is vaccinated appropriately and they have been given the chance to respond and their body does respond to that vaccine, if they are subsequently exposed to those diseases, they will not become infected. That is very different from, for example, our feline respiratory viruses, where even if a cat has been fully vaccinated, has had a chance to respond, and they do respond, they can get exposed to those viruses and they'll still get infected. They likely won't get as sick and they won't be as sick for as long. So it reduces severity and duration of disease, but they can still become infected. And that's important for us to understand because even if you're not as sick and you're not sick for as long, you can still potentially spread it to other animals in the shelter. For the vaccines that we have, if an animal responds, they start to respond really, really, really rapidly within hours of being given that vaccine. This is why it is critical for us to vaccinate so early when animals come in. However, full effect will take days or even weeks if that animal responds immediately. Because of that initial some protection, though, that can be the difference between life and death for some of these diseases, and it can also mean affecting the contagiousness. And so this is why it is crucially important for us to vaccinate immediately upon intake to the animal shelter. If we can vaccinate even before intake. For example, somebody comes and wants to surrender a litter of puppies. If we can say, well, let's vaccinate them today, but can you foster them for 2 weeks? Can you take them back home and then come back in later? So then they've hopefully had a chance to start to respond to that vaccination. So they're more protected when they do come in. So vaccinate right on intake. And when I say immediately, right, at intake, before intake, but immediately is within minutes, not even hours, and certainly not days. They need to be vaccinated immediately upon intake. We'll talk about when additional doses of vaccines are recommended for both adults and for juveniles, but we need to make sure that we're giving those additional doses on a shelter schedule and we're giving them on time. For some of these diseases, full protection can take weeks, depending on the disease, depending on the individual. And so those timely additional doses are also critical. When we have the option, we should always choose modified live vaccines as opposed to other types of vaccines like recombinant vaccines. They stimulate a stronger antibody response and they do it faster. So we should always choose modified live when we can. We'll vaccinate according to shelter guidelines, which I'll show you in a second. We need to make sure that we're storing and handling our vaccines appropriately. If we're not, they can lose efficacy. And in order to give those additional doses on time, we need to make sure that we're entering this into our shelter software and we're using those reminders so we don't miss those additional doses. What is that shelter vaccination schedule? So for DHPP for dogs and FERCP for cats, we start at 4 weeks of age according to published shelter guidelines. Now, you'll see I have on here potentially even younger. And so while current established guidelines say 4 weeks of age and older, in many shelters, in many communities that are high-risk communities or shelters, because the risk of parvo and panleuk is so high, we've actually started to vaccinate animals even younger than that. These vaccines appear to be safe, and maybe we'll get some efficacy at younger than 4 weeks of age for some of those animals. Again, it's weighing that risk versus potential benefit. And because the risk of that infectious disease is so high, we've elected to start vaccinating even younger. And you may ask, well, how much younger? As little as 1 day old. So immediately, right, in these animals. Happy to sort of chat more about that or share some resources if anyone's interested. Interval between doses. So when we're revaccinating, so we're giving puppies and kittens a series of vaccines, we want to do it on a 2-week interval if they're in the shelter. I have a range on here, 2 to 3 weeks. If they are physically in the shelter, I want to be giving that vaccine at 2 weeks on the dot, not two weeks in 1 day, 2 weeks on the dot, right? That longer interval, if they're in foster care and that foster can't get in, for example. But if they're in the shelter, I want to be aiming for that 2 weeks on the dot. We keep vaccinating puppies and kittens until they're 18 to 20 weeks of age. And even adults are going to get a second dose of that FERCP or that DHPP. Dogs also get Bordetella and parainfluenza. We want to choose an intranasal or an oral vaccine, and they get vaccinated at intake as long as they are 4 weeks of age or older. Some of these vaccines are actually labeled even younger than that, but definitely by 4 weeks. And then we'll vaccinate for rabies based on regulatory guidelines. So typically that's in the 3 to 4 months of age. The reason I have a plus minus here is we obviously want to vaccinate for rabies for public health reasons, but I'm not as worried about animals contracting rabies in the shelter. And so these other diseases, so for example, panleuk and parvo, bordetella, right? These are diseases that animals will get in the shelter. And so it's critical that we're vaccinating at intake with those. For rabies, this can be something that we do at any point up to adoption. There are some vaccines that exist out there, but that we don't recommend across the board. One of those is going to be chlamydia. So if your FERCP vaccine has a chlamydia component, you don't need that. It's not necessary. There's an example there of a tray of vaccines. Canine influenza, for reasons related to the type of vaccine that it is, even in areas where influenza might be circulating in the community, we typically don't vaccinate for it because protection is going to take such a long time based on vaccines that it's not helpful in the shelter setting. And then leptospirosis is one where current shelter guidelines don't recommend routine administration. However, this may be something that shelters decide to do based on it being really endemic in that area. We talked about how young animals are super high risk for infectious disease, right? They're vulnerable. They're also the ones that are most likely to be shedding infectious disease in the shelter. And so we are going to vaccinate them at 4 weeks or even younger in some situations. What's important to understand, though, is something called maternal antibodies. And so what are maternal antibodies? Antibodies are compounds that circulate in the bloodstream that will protect from a particular disease. They're specific to each disease. So for example, a dog may have antibodies to parvo, but doesn't have any antibodies to distemper. So they are disease specific. And then what are maternal antibodies? Maternal antibodies are antibodies that a puppy or kitten may get from their mom with early nursing. So this kitten that you see in the picture, if his mom had been previously exposed or had been vaccinated for Panleuk, when this kitten nurses in that first 24 hours, he may get some of those antibodies from mom that'll provide early protection. I say may because if she had never encountered Panleuk or was never vaccinated, she doesn't have the antibodies to even give him. The challenge is that while those maternal antibodies may provide some early protection, they also interfere with vaccination. So if we vaccinate this kitten while he's still got some of those maternal antibodies hanging around, those maternal or that vaccine won't be able to be effective, and so he will not get long-lasting antibodies that vaccine should provide. Well, he's got maternal antibodies, so he's protected, right? Well, he is, but only for a short period of time. Vaccine-induced antibodies last an extended period, but maternal antibodies decrease with time over the first few months of life. And the challenge is that we never know when those maternal antibodies have gone away. And it's unpredictable. And it can be different even for individuals within the same litter. What we do know is by 16 weeks of age, so by about 4 months of age, those maternal antibodies are gone. So this is important because this is a scenario that I sometimes encounter in shelters. I'll hear from a staff person that this 10-week-old puppy, he's had 3 vaccines or he's had X number of vaccines. So he's protected. We he can be exposed to parvo. He's not going to get sick. He's fully vaccinated now. We don't have to wear gloves. We don't have to take precautions. And unfortunately, that is not true. We don't know for sure that he is protected. He might be, but he might not be because of this not knowing when those maternal antibodies have gone away and when the vaccines that we're giving actually provide that long-lasting protection. So what does this mean in practice? We cannot consider animals or young animals protected until we've surpassed that point where all the maternal antibodies are gone and we've given them at least 2 vaccines. So clinically, this means 18 weeks of age or older, and we typically will actually just sort of round up to 20 weeks of age. So we make sure we've been continuing to vaccinate them and they've reached that 20-week mark. The number of vaccines does not matter. If we start vaccinating at 4 weeks of age, say they come in at 3 weeks of age, we're not yet doing that earlier than 4 weeks vaccines, but we start on the dot at 4 weeks and we keep going until they're 20 weeks of age. They will have had 9 vaccines and we don't know for sure until that 9th vaccine that they're protected because it's that 2 vaccines given at 16 weeks of age or older. Okay, so coming up, I want you to get ready because I'm gonna audience poll in the chat box. So get ready. We're gonna walk through some of these scenarios. So I want you to tell me yes or no based on the questions I'll ask. So we're gonna start with the puppy and the kitten on the left. Say these are 6-week-old puppy and kitten that come into the shelter. Are we gonna vaccinate them with DHPP, FERCP? I want to see your answers in the box. Lots of yeses. Lots and lots of yeses. I love it. That is absolutely true. We are definitely going to vaccinate them. We'll move down to the bottom and we'll move to this nursing mom with kittens or this pregnant mom cat and presume in this scenario that we are going to allow this mom to have this litter. We're not going to spay her before she's given birth. She's going to go to term. So are we going to vaccinate this mother cat and this pregnant cat? I'm seeing some yeses, lots of yeses. Fantastic. Yes, we are. Happy to talk more about that in, when we get to our question and answer session. But yes, we are going to vaccinate these cats. There sometimes is a concern raised, like, is this vaccine going to have some adverse effects on these animals, particularly for Panleuk? And here's the thing. The risk of those adverse effects related to the vaccine virus is essentially theoretical. What's not theoretical is the very real risk of panleukopenia in the shelter environment, a very real and very high risk. And so I'm absolutely going to vaccinate both of these cats. I may even vaccinate all of those neonates, right? Depending on the risk. Okay, next up, we'll go to the puppy and the kitten on the right-hand side. And so kitten with some upper respiratory, puppy with some nasal discharge. Are we gonna vaccinate them? And I'm seeing Lots and lots of yeses. I love it. Yes, the answer is we are also going to vaccinate animals with signs of infectious disease. For me in the shelter, again, I'm looking at the risk benefit. The risk is that maybe their immune system is fighting off whatever they're dealing with, and so maybe they won't respond as well. But any protection that they can get for these potentially fatal diseases is going to be important. So I absolutely am going to vaccinate them in the shelter environment. And then last up top, so I have this tiny little puppy and kitten. So say these are neonates coming in 2-3 weeks of age. Are we going to vaccinate them? I'm seeing lots of yeses. The answer for this is it's a little bit of a trick question because I told you yes or no. The answer is maybe. And I will say in lots of shelter environments, we are making the decision to vaccinate because this is a relatively new practice. This is something that I think every shelter has to decide with veterinary guidance and based on their risk in their shelter and their foster program, right? But essentially more and more, I think the answer is becoming yes. So to answer the question, who gets vaccinated? Essentially, it's everyone. And maybe it's not everyone in every situation, but it's nearly everyone. And in a lot of situations, it is everyone. All right, storage and handling. So, we're giving these vaccines, we're giving them at intake, maybe even before intake, and we're doing it on an appropriate schedule. But if we're not storing and handling those vaccines appropriately, they can lose efficacy. And so they need to stay refrigerated. Each vaccine has the published temperature range actually on that vaccine tray. And we need to monitor that temperature to make sure they're staying within that range in the fridge. We love these little dorm fridges in shelters. They're so convenient. We can put them in lots and lots of places, right? We can have it right at our intake bay. But I think we've all probably experienced, these fridges sometimes freeze things. Or every time we open them, right, that temperature is not maintaining at that range that we need it to be. And so, unfortunately, as convenient as they are, we don't recommend those in shelter settings. If you do need something small, there are medical grade fridges that are purpose built for this. And so that's what we recommend, or a full size fridge. If we are taking vaccines out into the shelter to administer, say we're doing those additional doses, we want to make sure that we're putting those in a cooler for transport. And we also want to make sure they're not directly in the ice pack because we also don't want them to freeze. So we don't want them to get too warm, but we also don't want them to freeze. And then for vaccines for which we have to mix them, like the FERCP in the picture, we want to mix those right before we administer them. Put in the chat box, how long are vaccines good for once they're mixed up? Yeah, so I'm seeing 20 minutes, I'm seeing an hour. Depends. So one shelter does 15 minutes or less. Yeah, so it depends on kind of what vaccine, what rep you talk to. You'll hear anywhere from 15 minutes to an hour. The reality is, if I open the fridge and pull out a mixed up vaccine, I don't know if that was mixed up 5 minutes ago or 5 hours ago. And so for me, in practice, we should just mix them immediately before administering, but somewhere in that 15 minutes to an hour range, again, depending on who you talk to. But for me, this means I'm just going to mix it up right before I give it. All right, let's move on to sanitation. So in our strategies for disease prevention, those sort of big categories that we talked about, we have reducing physical transmission. And so this is where sanitation comes in. So as we've talked about, these pathogens are microscopic. A surface could be contaminated or a kennel could be contaminated and we can't see it, right? Even after we've removed the fecal matter, there could still be that contamination. And so it's sanitation that allows us to inactivate any of that remaining pathogen that's there. Sanitation requires 4 steps always. It's removing the debris, so removing the food, removing the poop, all of that. It's a degreasing step. So some of these pathogens, after that obvious material has been removed, we can have films where that pathogen resides in. And so we want to take an extra cleaning step. But even then, we can still have viable pathogens that are on that surface. And so then we disinfect. And this is where we use our disinfectant product, for example, Rescue. And we always make sure that we're using it at the right dilution and for the right contact time in order for it to be effective. And then we use a drying step. So many of the pathogens that we care about, the survival is favored in wet environments. And so drying can be important to reduce that pathogen survival. We want to use that proper dilution every time. And so we recommend commercial dilution systems. We recommend systems that have the dials that you can select that dilution. That's what's in this photo here. And we also recommend checking your dilution. And so if you're using rescue, you can get these precise indicator strips. And what these do is it allows you to actually check the dilution of your rescue, what that actual dilution is in practice. And so you can see rescue has different options. You can dilute it at 1 to 16, 1 to 32, 1 to 64, even higher than that, right? And these little strips will show you what that dilution is. So here's examples from a shelter that we were at and we actually tested. And so this first one is from a bottle that was labeled 1 to 64, and I went and tested it. And that sort of color change somewhere in between 1 to 32 and 1 to 64. So it's at that concentration or more concentrated. So I'm good with that. And this was a bottle that was labeled at 1 to 16. And that is definitely not 1 to 16. This was actually a bottle that was being used to clean in an area and disinfect in an area with puppies. So some of our highest risk animals in the shelter. And unfortunately, that bottle was not at the proper dilution. I suspect that this was mixed up a long time ago. It didn't have a date on it. And so you also need to know for the product that you've chosen, is it, what was the date? How long is it good for? For rescue, it's 90 days. It's shorter for other products. Disinfecting contaminated areas. And so sometimes in shelters, I see signs like this, where we know we have parvo contamination. And so we'll go ahead and clean and fully disinfect 3 consecutive times. Does it require 3 rounds of disinfection to kill any of that parvovirus that's there? The answer is it doesn't. So why do we do this? The reason is the product has to make contact for that full contact time. For rescue, as an example, it's either 5 minutes or 10 minutes, depending on the dilution that you're using. And the product has to make contact for that entire time. And so the risk is, if there's a crack or a crevice or potentially part of the bars, right, that rescue is not making contact with, that it's not going to disinfect that area. And so the reason that we do this multiple times is to make sure that we're getting product in all of those cracks and crevices. If we are not fully disinfecting, it doesn't matter if we wait 6 months to put an animal in a parvo contaminated kennel, or if we put that animal in immediately, right? What does matter is that we're disinfecting appropriately. And if we're disinfecting appropriately and we've inactivated all of that virus, we're using a product that's effective against that pathogen, we're using it at the right dilution and the right contact time, we can put a new animal in that kennel essentially right away. These are some examples of common equipment and some challenges around this. So in the first example, that microchip scanner was actually a scanner that went into a ringworm isolation ward and then came back out and was set on the counter and then sprayed off. And you can potentially see this. The rescue is only making contact with the bottom portion of that scanner, right? So if the top part of that scanner, if the back of that scanner that's on the table are contaminated with ringworm, that's not getting inactivated by that rescue, right? And so the next animal, the next area that scanner goes to is potentially going to transmit that ringworm. That scanner is a fomite. Similarly, in the picture with the scale, right? Again, it's been spritzed off with rescue, but that rescue is not actually making contact with that whole surface. What if we have these situations, but oh my gosh, we don't have the time to sit and wait around for that rescue to make contact for 5 or 10 minutes? And it's thinking about what are opportunities for physical barriers. And so in this example, you can see it's just putting a piece of newspaper or a towel over that surface or whatever it is that we're doing, that table, that scale, right? So that you don't let your scale be a fomite. Here's some more examples, actual pictures from shelters, right? So you can see on the kennel bars, like all of the debris, the material that's caught in those little cracks and crevices, the material that's left, on the chain link that's actually on the hand sanitizer. And so these are places where those potential viruses or other pathogens could live. In this picture, you can see on the back, on the glass, so for kittens, cats with upper respiratory, we can have these pathogens actually living in those films and that residue that's on that glass. All right, I'm interested to hear from you. So pop in the chat as we kind of keep talking. What disinfectant product or products are you using in your shelters or in your foster programs or your rescue groups? I'm smiling because I'm seeing lots and lots of rescue, which is fantastic. for some reasons that we'll talk about on this next slide, that is often the one that we recommend. And so this is a great disinfectant quick reference from the ASPCA. What's important on here is this non-envelope viruses. And so non-envelope viruses are a type of virus. These are our hardy viruses. And essentially the ones that we care about in shelters are parvo, panleuk, calicivirus. They all fall into this category. And rescue at a 1:32 or 1:16 dilution is effective against these. So fantastic that you all have chosen rescue. What I want to call out is that quaternary ammonium compounds, what we call quats, are not reliably effective against parvo, panleuk, calici, even though they come with names like Parvosol, or they say on the barrel, effective against canine parvovirus. And I see these in use in shelters and in veterinary clinics. And when we look and with independent research and we actually test these, they're not reliably effective against these compounds or against these hardy pathogens. And the way that you know it's a quat is you look at the active ingredients and it has that ammonium in the name. And unfortunately, like I said, these are not reliably effective. So if you run into shelters or programs that are using these, it's important to note they're not reliably effective. Okay, so we go through our full deep cleaning, our disinfection process when we are moving one animal out and putting a new animal in a kennel, right? But what if the same animal is staying in that kennel? And in those situations, spot cleaning is appropriate. This actually reduces stress, and that becomes critically important, like we'll talk about in a little bit, when it comes to cats in the shelter, but really all animals in the shelter, because stress suppresses their immune system. And so if they are remaining in that same kennel and they haven't just absolutely made a giant mess of things, it is appropriate for us to just spot clean. Even if we have to clean up a little more than that because of the mess, if we can leave items in that kennel that have their same scent, behaviorally, that's good for them. That will reduce stress. And so that's what we recommend. ASPCA has some great videos that demonstrate the process. All right, biosecurity. So, we talked earlier, think back to that black light, pretend panleukopenia, pretend distemper pathogens on hands. So how do we prevent the physical transmission in those settings? How do we keep from being fomites? And that is through hand hygiene and through personal protective equipment. So for our hands, it's things like gloves. For the rest of our bodies, right? It's gowns. For example, if we know we're going into an isolation ward, maybe we put on a full gown, or you can see the staff member in the photo. She's got on the whole Tyvek suit. Those yellow isolation gowns are great if we're dealing with cats, but if you're dealing with big dogs, right? Like they do nothing to protect the lower half of your body. And so she is about to go into a large dog isolation ward. And so that's why she's got the whole outfit. When we use PPE, we need to make sure that we're putting it on and taking it off, called donning and doffing, in a way that is not going to actually then contaminate our clothing. And then we need to make sure that we change in between animals. And so gloves do no good in terms of preventing disease spread if we don't change them between one animal and the next. Sometimes like we talked about, healthy animals can be contagious, but we're not going into an isolation ward. This animal looks healthy, but we're still concerned, right? Do we need to do the full gown or the full Tyvek suit? And maybe the answer is no. Maybe the answer is yes. But if the answer is no, what can we still do to take some extra precautions? Something as simple as a towel or a blanket. So you can see the technicians in the photo. They're inducing this healthy adult animal for surgery. But this dog came from a high-risk shelter, and so we're worried about infectious disease. My technician in the photo, she's just got a towel, over her body to protect her from becoming contaminated. Okay, what do you all think about foot baths? Yes or no? Is this a good way to prevent the spread of disease in the shelter if we're worried about our feet becoming contaminated? Fantastic. Lots and lots of no's so far. Right. So just like we've talked about, even if this foot bath is full of rescue, unless you're standing in that foot bath for 5 or 10 minutes, it's not going to inactivate those pathogens. And I don't know about you, but I do not have time to stand in that foot bath for 5 or 10 minutes, right? What about the hand sanitizer? What do you think about that? Is that reliable for example, staff in the shelter to prevent transmission of these infectious diseases? Great. I love it. Lots and lots of no's so far. Yeah. So the answer for both of these is no. Hand sanitizer we'll talk about in just a little bit, but it is not reliably effective against parvo, panleuk, ringworm. This is a lovely sign from a shelter that we visited. So must use PPE, puppies or lava. And I just loved this. So if we need to take precautions, if we're worried about the spread of disease, then for us, for staff, it's going to be PPE because we closely handle lots and lots and lots of animals. Okay, so the flip side of this is, here's a couple of signs also from different shelters. Please, for their health, don't touch any of the animals. Please do not touch the kittens. What do y'all think about these? Is this a good way to prevent the spread of disease? We're worried in the situation about the public, about potential adopters spreading disease. Do you think this is a good idea in shelters? Nobody's as quick to respond. See, I have less than ideal. I would agree with that statement. No needs more. Yep. So no prevents adoption. Also, people don't listen. Some mixed emotions. Yeah. And so a couple of you have said it's not a good way to get animals adopted. And so here's the thing of everything we've talked about so far, even more important than all of that, the thing that will prevent the spread of infectious disease is to not have animals in the shelter. What we do know is what can make the difference between a potential adopter actually deciding to adopt is interaction with the animals. In order to do that, they have to touch those animals. And so in order to get those animals out, we actually do want adopters to interact with them. Now, in an ideal situation, I would love it if every single potential adopter wore gloves, right? Or wore PPE, but that's unfortunately not realistic, right? And are people going to listen? And I don't know about you, but in the shelters we work with, staff don't have the time to police those potential adopters. And so here's the thing. When I think about what level of biosecurity measures to take, I think about assessing risk, and I think about the risk for that individual animal, right? So high risk animals, new intakes, puppies and kittens. And so we're likely going to do more in those situations. I think about the population, right? So is this a population with a lot of infectious disease in it? I've worked with shelters that have this temper endemic in the community and the shelter, and that's a really high risk population. So we're going to do more in those shelters. I also think about the people. Is the staff? Is it us that are doing close handling, handle sick animals, handle lots and lots of animals very closely? Or is this potential adopters that are only handling a small number of animals? So for example, if we're going into parvo, right, we're going into parvo isolation, we have to wear gowns, gloves, booties, we have to do all the things. But maybe for those potential adopters that we don't have time to police, again, I'd love it if they wore gloves or if they really fully wash their hands in between animals, but potentially putting up a sign, providing hand sanitizer for them. I'd rather have them comply with a lesser measure like hand sanitizer than non-compliance with stronger measures like asking them to completely wash their hands, because again, us having the time to follow them around, probably not realistic. And even if we hang up signs like that, is that actually going to prevent the most important thing for preventing disease spread? And that's them getting out. Okay, let's talk a little bit about animal flow. And so the first thing will be reducing overcrowding and density. And so this is thinking about reducing potential exposure points. So in this example, we have this orange dog in the center, and we have every single dog run is full. So completely full kennel. Say this dog has distemper and he starts coughing. And so he coughs his virus 20 feet. In a full kennel situation, he is going to infect all of these dogs. Now, same scenario, right? So this dog in the center of the runs, but our runs aren't full. We have some empty spaces in between dogs. Same thing, he starts coughing, still coughs 20 feet, but in this scenario, only this many dogs get infected. So fewer dogs get infected. Also, reducing movement. So again, we'll keep going with this scenario, but so one of his neighbors that was recently infected, not yet showing signs, but gets moved to a different run, say during the cleaning process. Then when he does start coughing, he starts coughing his virus 20 feet, and so then infects these dogs, right? And so this is how you can see how pathogens can be transmitted rapidly and even more rapidly in an overcrowded, very population dense environment, and how movement can contribute to that spread. So what do? We try to reduce crowding, we try to reduce density. We don't mix unrelated animals. Even if we're having capacity challenges, combining two unrelated animals, that is a recipe for disease spread. So then I always get asked about playgroups. We're putting a whole bunch of unrelated animals in playgroup together. And for me, this is about balancing risk and life-saving. And so putting a bunch of healthy appearing adult dogs in playgroup together outdoors for 20 minutes, relatively low risk as compared to, putting two unrelated dogs together 24/7 in an indoor kennel, as an example, right? That playgroup risk is much less. And that life-saving benefit is huge for those dogs, right? And so for me, again, like so much of what we do, it's balancing risk and life-saving. And so for me, that life-saving benefit way outweighs that risk. We're going to select healthy, adult dogs, balance risk. If we decide that doing play groups with puppies, what puppies are we going to select? That's higher risk than adults. And if we're in the middle of a distemper outbreak, as an example, we'll probably pause our play groups, right? And so it's, again, just balancing that risk and life-saving benefit. Okay, next, let's dig into that, what I mentioned about a doctor interaction and getting animals out. So length of stay. This is defined as the length of time, usually measured in days, that an animal spends in the shelter. Why is length of stay important? Hands down, it is the most important risk factor for infectious disease in shelter animals. And the most important thing we can do to prevent disease is get them out of the shelter. Length of stay also matters because of stress, because of behavioral decline. We've all seen that happen with some of our long stay animals. There's more cost in terms of labor, in terms of resources to care for those animals. And it means that we don't have as much capacity if that one animal stays a really long time and that kennel's full. And what I don't have is that space for the next animal that needs our help. And what happens with longer length of stay is those animals will get sick and they have to wait on medical care. And because nobody wants to take home a sick pet, we have a decreased adoption likelihood, which means they stay even longer. And then they get sicker, and we keep going around and around this vicious cycle. And what that means is those animals, while they're waiting and while they're getting sicker, they have poor individual welfare and we have more crowding. And so not only is it worse for the individual, but it's also worse for the whole shelter. Now, we could have an entire session about reducing length of stay, and we do have lots of resources on our network.bestfriends.org on how to reduce length of stay. But this is just a preview. It's fast tracking. So these highly adoptable pets, especially our puppies and kittens, let's get them through the shelter system as fast as we can. Reconsidering quarantines. If you are hanging on to healthy appearing animals as a routine intake quarantine, we want to reconsider that. Routine quarantines, it just serves to increase length of stay, and that will just keep them in the shelter longer. We do everything that we're talking about preventing disease, right? Because that means they'll stay longer. We try to identify what bottlenecks we have in the shelter and can we address those bottlenecks. We take on managed intake practices so we can control the intake of animals to the shelter to reduce that overcrowding. Open selection, which is if you are an organization that has holding periods like stray holds, you still allow the public to see those animals. And so they can express their interest in adopting that pet. The moment that stray hold is up, they can take that animal home and fully adopt. And then daily population rounds, which are a cornerstone practice for population management. If you want more information on population rounds, we have a recorded webinar that we did several months ago, and I encourage you to check it out. If you're not doing daily population rounds in your shelter, I encourage you to start. Okay, lastly, let's talk about some isolation of sick pets. So in the event that an infectious disease does happen in your shelter, we need to rapidly identify that disease and we need to pull that animal out of general population. So these animals are highly, highly contagious. They're dumping tons and tons of pathogen into the environment and onto their neighbors. And so we need to pull them out of general population so that disease doesn't continue to spread. If we don't have great isolation space, or even if we do, foster care is often a better option. And so I encourage you to think about that. And then if we're not sure of the diagnosis, we want to confirm it, monitor any animals that were potentially exposed to see if they're going to start showing signs of disease, and make sure that we don't expose new animals or other pets. In the shelter, disease recognition is everyone's job. I want for every single person walking through the shelter, every volunteer, every staff member to be able to recognize infectious disease and to know what to do when they see it. I love it if they are empowered even to take action, and they all should know what steps to take, whether that is them putting on the PPE and actually running the parvo test, or if it is going and notifying, for example, the medical staff right away or notifying a supervisor. Sometimes I hear this in shelters, like, what if we can't isolate? We don't have a designated isolation ward. And sometimes we get creative and so we create isolation spaces. And so there's a couple examples of converting a bathroom either temporarily or permanently to be your isolation space. And then the example on the right is our Hurricane Harvey temporary response shelter. We actually had a distemper outbreak. And this is all these dogs, hundreds of dogs housed in one giant room. And that is often the experience of many shelters that don't have purpose-built isolation wards. And what I hear is, well, we can't isolate, so we can't treat, for example, respiratory disease. And I would disagree. While it is not ideal, you can tarp off or section off various areas of the shelter and section off like one set of runs or one aisle and designate that as your isolation ward. Hang up tarps, hang up signage, and wear PPE to go into that area and sort of create that isolation ward. And we absolutely have used that in outbreak scenarios. You can still set up an ad hoc isolation in this way. Even better, to isolate outside of the building. And so these are examples of foster or adoption promotions for ringworm. Prevention starts before intake. So I also commonly will see where disease transmission can happen on the animal control vehicle. And so even before that animal comes into the shelter, we have to take precautions around preventing infectious disease spread. Either sick animals will get put on the truck together, or that vehicle is the fomite because it's not being sanitized appropriately. Managed intake, so intake by appointment, will allow us the time and space to have conversations. So maybe those animals don't even have to come in. Maybe we can postpone that intake until vaccines have had a chance to kick in. At a minimum, it's asking those questions based on history to see if there is potential red flags for infectious disease. All right, quickly, let's run through our common infectious diseases that we see in shelters and how all of this applies. So canine infectious respiratory disease, caused by viruses and bacteria, often multiple in the same animal. And transmission is direct contact, it's fomites, and it's those dogs coughing their pathogens up to 20 feet. The cornerstone here is going to be rapidly identifying them and isolating them. And then, just like in that little graphic with all of the dog icons, it's reducing length of stay so they don't have the chance to break and cough on everybody, and reducing movement. Canine distemper for those areas that have to deal with this, which is a lot of parts of the country and many shelters. Key point here, I hear from shelters all the time, like, well, we don't have distemper. And unfortunately, that classic neurological dog that we think of with distemper, that only accounts for about 10% of the cases. So the other 9 out of 10 dogs look just like kennel cough. Transmission it's direct, it's via fomites. By and large in the shelter, it's fomites, although it is transmitted via aerosols in the urine and in the feces. Shedding is not as long as we once thought, and I'm happy to dive into that in more detail. We used to think these dogs were contagious for really prolonged periods, and new guidance has suggested, new research is suggesting that it's not nearly as long as we once thought. One nice thing about distemper, it lives for a few hours, but it doesn't live for days or months like parvo and panleuk do. Still enough for fomite transmission, so still important for us to take biosecurity precautions. And then I have on here a picture of some distemper survivors. I was taught in school that it was a death sentence, and that is absolutely not true. We can get survival rates up and above 90% if we do have the resources to isolate and treat these dogs. All right, parvo, classic signs are vomiting and diarrhea, sometimes with blood, but maybe it's just lethargy or decreased appetite. And for me, any quiet or dumpy puppy is parvo until proven otherwise. So that my bar for testing is very low. Any puppy that's just quiet, we want to think about parvo, has to be on our list. And parvo is contagious before these animals start to show clinical signs. And so the bright, happy puppy at 8 a.m. that then develops diarrhea on the surgery table at noon, and this has happened to me, when I think back to how that puppy was being handled at 8 a.m., it was shedding parvo then. And so if we weren't taking precautions with that healthy puppy, we were potentially spreading parvo everywhere. So think about those fomite transmission and think about these scenarios, that invisible parvovirus, right? It does live for months in the environment or on those fomites if we're not disinfecting appropriately. And so we need to make sure that our sanitation measures are appropriate. Panleukopenia in cats is very similar to canine parvo, same sorts of transmission, also hardy in the environment. Classic clinical signs, vomiting in kittens, diarrhea. The biggest difference with panleukopenia is that oftentimes the disease progresses so quick, we don't actually have time to see those GI signs. And so any sudden death in a cat or a kitten in the shelter, the most likely cause is panleukopenia. And so that warrants testing. Feline URI. This one is a little bit different than everything else that we've talked about so far. So spread by or caused by viruses and bacteria. But here's the kicker. If we test healthy cats on intake, we will find these viruses and bacteria in healthy cats. But not all cats get sick. And so why is that? When we talk about transmission, often these cats are already infected by the time they come into the shelter. If they're not, they can potentially become infected through direct contact, through fomites. Even though these are respiratory viruses, we don't clinically recognize droplets or airborne transmission for these pathogens. But why is it that some cats get sick and some don't? And it is about length of stay, and it's about stress in the shelter. Healthy cats can have these pathogens. The difference is the quality of the housing and how long they're spending in the shelter. And essentially, if we keep them in the shelter long enough, it's almost inevitable that they're going to break with upper respiratory. So what do we do about that? Well, we try to get them out. And during the time that they have to stay, we give them better housing. So we give them greater than 8 feet of floor space. That's been found to be protective and reduce the upper respiratory risk. What that means, double compartment housing, right? So you can see the cat in the picture with the portal. It's decreasing movement, including movement to clean, right? So spot cleaning if that cat is remaining in that same kennel. And for this reason, isolation may not be needed. So if I have a cat that breaks with upper respiratory, me moving that cat to isolation, moving its kennel causes stress, and that may actually make his disease worse. Okay, last is ringworm. Transmission here, direct or from the environment, also very hardy in the environment. We know, right, this can take weeks to fully treat, and we do need to keep these cats in isolation. I strongly encourage you to consider foster care. Ringworm spores are hardy in the environment, but I will also tell you, don't be afraid of designating ringworm isolation space, because if we're dipping cats, that environmental contamination is actually quite low. So we need to take precautions, but we don't have to be afraid of ringworm. Okay, we're wrapping up. Tell me, drop in the chat, what are some signs of infectious disease? If you leave this webinar and you walk through the shelter, what is going to raise alarms for you if you're walking through the shelter and you see it? Answer in the chat. Fever, lethargy, yep. Nasal discharge, coughing, healthy looking animals, right? We may not always see it. Yeah, totally true. Sneezing and coughing, yeah. So hair loss, right? So for ringworm, for some of our skin pathogens, crusty eyes, nasal discharge, right? It's more nasal discharge, vomiting, diarrhea, especially with blood, or hair loss. Yeah. So what to think about? Any animal could be contagious. Think about all of the invisible pathogens, all the invisible germs. Always ask yourself, what PPE should I be using to both protect myself from becoming contaminated if the animal that I'm handling looks healthy but is actually spreading or contagious, and also to protect the animal I'm handling. Maybe I touched a door handle that was contaminated and I didn't know it, and my hand actually has parvo on it. If I put a glove over that hand, then the next puppy that I touch, I'm hopefully preventing infection. Disease prevention is life-saving. We can prevent disease with biosecurity, with sanitation, vaccination strategies, reducing length of stay, reducing movement. When you have disease, identify and isolate, except feeling upper respiratory tract disease. Happy to dig into that more if we need to. And then if you are worried, you're experiencing an outbreak, you have disease concerns, ask for help. That's what our National Shelter Medicine team is here for. And you can reach out to us at sheltermedicine@bestfriends.org. And then I also have my contact information there. If you're interested in seeing what some disease management protocols look like, or treatment protocols, we have some templates for you. And this can be used and implemented in conjunction with a veterinarian at your shelter to manage and to treat infectious disease in your shelters.